recent announcement from the US Department of Health and Human Services, HHS, has stirred quite a debate, urging pregnant women to steer clear of acetaminophen, commonly known as paracetamol in the UK, and the active ingredient in Tylenol, due to potential links to autism in unborn children. This recommendation comes as a shock to many, especially since millions of expectant mothers have relied on paracetamol for pain relief and fever management throughout their pregnancies, believing it to be the safest option available. But now, this long-held belief is being called into question. The HHS's warning is grounded in a systematic review led by Andrea Baccarelli, the Dean of Public Health at Harvard. This review claims to have found a strong, consistent association between prenatal exposure to acetaminophen and conditions such as ADHD, autism spectrum disorders, ASD, and other neurodevelopmental disorders, NDDs. The authors assert that their findings are robust, having been supported by studies that controlled for various confounding factors, utilized negative control exposure periods, and employed propensity score matching. However, there's a significant flaw in this reasoning. The methods used in these studies are not as reliable as they claim, and crucial evidence that contradicts their conclusions has been overlooked. One of the most critical oversights in the review is the dismissal of sibling control studies. These studies compare siblings who were exposed to Tylenol in utero with those who were not, providing a more accurate picture of any potential causal relationship. Alarmingly, these sibling studies did not reveal any concerning links between Tylenol exposure and autism. This raises an important question. Why did the authors choose to ignore such compelling evidence? It seems that their eagerness to support a narrative that Tylenol could be harmful may have clouded their judgment. In one of the most comprehensive studies conducted, researchers analyzed data from nearly 2.5 million births in Sweden from 1995 to 2019. They meticulously measured Tylenol exposure in a country where most of its use is prescribed. While they found that mothers who took more Tylenol during pregnancy had a higher incidence of autism and other neurodevelopmental disorders in their children, they also discovered something crucial. When comparing siblings with differing exposure levels, the child exposed to Tylenol was no more likely to develop any disorder than their unexposed sibling. This finding strongly suggests that the correlation observed is not indicative of a causal relationship. The review itself is riddled with logical inconsistencies. It presents weak evidence as if it were robust, fails to quantitatively synthesize the findings from the studies it references, and even misrepresents some studies in ways that contradict their own conclusions. This lack of rigor is troubling, especially since it feeds into a narrative that many people are eager to believe, that Tylenol is a contributing factor to autism. As a result of this flawed interpretation of science, countless pregnant women may feel compelled to avoid Tylenol or any paracetamol product, even when it may be the safest option for managing their pain or fever. For mothers in need of relief, the alternatives are limited. Opioids are not a viable option, and ibuprofen is generally considered unsafe during the early stages of pregnancy. If it were indeed true that Tylenol posed a risk of causing autism, there would be a significant discussion to be had regarding the risk-benefit analysis of its use during pregnancy. However, the overwhelming consensus in the scientific community is clear. Tylenol does not cause autism. When public health authorities misinterpret scientific data, the consequences can be dire. Who will advocate for the mothers caught in this web of misinformation?